For his take on all things coronavirus, let's bring in now Dr. Norman Swan, the presenter of the RN Health Report and Coronacast. He joins us from Sydney. Norman, good morning. Let's talk about the TGA approving the Moderna vaccine. In your view, how much of a, game changer, yes or no, will this be for the vaccine rollout?
It adds extra supply, which is great. Unfortunately, it's not earlier. So it simply adds to the supply. It's not a game-changer vaccine. It's the same performance characteristics as Pfizer. It's almost the same. It's virtually the same technology. So it's a good vaccine, and it's great that we've got it, and it will help with the supply moving forward to the end of the year.
And the TGA also has approved a new treatment that was discussed very briefly at the press conference yesterday. What do we know about that?
Sotrovimab is an monoclonal antibody which goes for the spike protein on the virus. And so I think there's been a bit of controversy about it as to whether or not it really is going to make a difference. It's expensive. And I covered this on the Health Report last week. These monoclonal antibodies, they're still in trial. There is reasonable evidence for this one, but it's not a game changer. It's something that you give early on in the symptomatic disease to help prevent people going on to hospitalization, which is a good thing. But the problem is, who do you give it to? How do you identify them? How do you make that selection? It would probably be to the frail, elderly and the vulnerable, or people who look as if they're going downhill. But once you're in hospital, it probably doesn't make a lot of difference. It's got to be given early in the disease. So you've got to set your expectations clearly as to what difference it's going to make.
Now, all eyes, Norman, still very squarely on New South Wales, particularly as selected regions in that state are plunged into 7-day lockdowns. We all know about the Prime Minister's 4-step plan to get us out of the pandemic. How important is it that New South Wales controls this outbreak, not just now in Greater Sydney, but in those regions, if we're to achieve that 4-step process?
Well, anybody watching us from any regional part of Australia is vulnerable to COVID-19. Pardon me. I think they thought that they're not, because they're widely apart and what's the risk. But the second wave in the United States showed that regional areas are at risk of COVID-19, and many regional areas are a bit untested, less so in Victoria, but more so elsewhere. So lockdown earlier is the right thing to do there. But New South Wales is critical to the success of the 4-stage plan. You can't open up Australia until New South Wales is under control. And many experts believe it won't get under control. I mean, it's under control at the moment in a sense that it's slowly increasing. But if it increases at the present rate, it could be at 1,000 cases a day into September, unless vaccination turns that around. And it should turn it around, but it's got to get out there quickly. So, but what happens if all vaccination does is keeps it at 200 cases a day? What's the rest of Australia going to do with New South Wales? That is not clear.
Well, what happens feasibly? I think it was the Finance Minister, Simon Birmingham, saying yesterday that New South Wales, if that was the case, could be shut off from the rest of Australia heading towards Christmas.
That's absolutely right, because I can't see the other states opening up unless they get to high vaccination rates. I mean, in many ways, unfortunately, in some ways, New South Wales may show the way. They may show that you can actually live with 200 cases a day with high vaccination rates. You've got very low hospitalizations. This then becomes political. If you're Mark McGowan, are you going to open up and take, you can convince the Western Australians that you should open up and accept infections? But at some point, Western Australia and the other states are going to have to open up and accept infections into their community, and New South Wales may show that it's relatively safe to do that. But the risk is that it runs out of control in New South Wales if they open up too early.
So can we just look at what's happening in Melbourne and Cairns? Cairns, we've had that taxi driver, so we don't know how many more people, if any, that he might have spread COVID to. In Melbourne, it's looking pretty good because people have been in isolation, but what's the chance of either of those two places being out of lockdown anytime soon?
It's impossible. It's really hard to say because there are so many surprises with this virus. I think Cairns is potentially, well, Cairns and Victoria are risky. There's still people popping up who have not been in quarantine and who are infectious in the community, and that's where the danger lies. So you've just got to lock that away so that 100% of your cases are in quarantine. Then you can start relaxing. Cairns is still an open question, I think.
And finally, before you go, Norman, how important are these mass vaccination hubs in helping to reach those national vaccine targets?
Well, congratulations to Western Health and all the team there. They've been doing an amazing job in Victoria in vaccination. Look, we've got to take vaccination to the people and vaccines to the people. Supermarkets, pharmacists are going to do a great job. Whatever we can do, Australians are not truly vaccine hesitant. They'll get the vaccine if it's easy to get, and it's just been a little bit too hard to get at the moment. Stories about the booking system and so on. So take vaccines to the people in whatever way you can. Get rid of booking systems so that you can turn up as long as you're eligible to turn up. Those sorts of things are going to make a big difference. And just another call out to over 60-year-olds, get these Astra vaccines into your arm now so that we're up to 90-95% in over 60-year-olds. And think about it hard if you're under 60.